Mm-hmm. And sorry, Gary, do you have a question?
Yeah. Hi. Can I just ask? Is it frequently misdiagnosed?
Sorry, I overheard. What did you say? Can you repeat it?
Yeah. Is it? Yeah. Sure. Is the disease frequently misdiagnosed? And if so, what is it? What is it?
Yeah, I have seen in past patients really misdiagnosed. We got patients treated initially as a cutaneous T-cell lymphoma, mycosis fungoides. We had patient under diagnosis of MDS or AML, and even now with all technology available, it can be really difficult to distinguish, for example, patients with AML and blastic plasmacytoid dendritic cell neoplasm, so it's not, again, black and white here. There is overlap. We had even patients who had in skin blastic plasmacytoid dendritic cell neoplasm, and then in bone marrow MDS. So you have, and it's possible because we now know via next generation sequencing when many mutations seen in MDS or AML can be also part of blastic plasmacytoid dendritic cell neoplasm genetic landscape. So there is definitely overlap of these diseases.
So there's a percentage that is cited in literature, not 0.44%, as a prevalence of all hematological malignancies. So is it a real number, or is it a correct way to think about it, this prevalence, or not?
It's tough. It was a while ago. We look at different review papers or different epidemiological data. And so, it depends what you look at. With 0.44% was of all hematologic malignancies. Then we got data that it can be also as a 1% of acute leukemias or 0.7% of cutaneous lymphomas or about 6% of NK cell malignancies. So it depends how you look at it, So, but nobody has really very good epidemiological data. It's rare disease. When we did our review about 5 years ago, there was someone did before us a review until 2005, and they collected about only 100 cases, and between 2005 2013 we counted about another 100. So and now it's 5 years later. So I would say several hundred cases were only described in literature. And even if you look at national registry, sometimes over 20 years, these registries have around 100 patients. So it's it's still very rare disease.
Interesting. And what is your current approach? What is the current standard of treatment?
We still follow that old approach we establish over years, but we divide patients who come to clinic into two major groups: patients who are transplant candidates and patients who are not. And in patients who are transplant candidates, we usually treat them with one of acute lymphoblastic leukemia or aggressive lymphoma induction chemotherapy regimen, which can be CHOP, Hypercivat, eCHOP, any of these regimens which we use. And patients who achieve remission and they have donor, they go to allogeneic stem cell transplant. And then there is obviously a relatively significant group of patients who cannot go for transplant from different reasons. I would say most frequently it is age, because this disease is usually a disease of older patients who have a lot of sometimes comorbidities, so